Have you come across videos of ASMR slime on Instagram? It's my latest obsession. And uh, a friend sent it to me, and ever since I've been hearing the sound of a particular kind of substance called slime, and they keep scrunching it. And it gives me immense relief, and I loved it. And so I thought to myself that, you know what, I really want to get hold of that. And I went to a market in Gurgaon and I asked the shopkeeper, no one had it. So it was a fair bit of walking around. And it's winter, so you do get thirsty. It is a bit of a dry weather and it was quite polluted. So my throat was very scratchy and I kept drinking water. And because I was so focused on getting my hands on the slime, um, I lost track of how much of water I was consuming, something I very rarely do when I'm out in public spaces in India. And well, the water went through my system, and eventually I needed to go to the toilet. And that is when I realized that, oh, I've had too much of water. This is Nalia Charji, and you are listening to Health Wealth, a podcast that hopes to leave you better informed in a factual and scientific manner about all aspects of your well being, but also to leave you feeling very motivated to make the right choices for yourself. The reason I have a water quota every time I go out into public spaces is because I am terrified of using toilets. And this fear comes from having observed multiple ladies of my family and of other people's families having dealt with urinary tract infection, or most popularly known as UTIs. And it is not nice. It is not nice at all. It is not something I ever want to experience. And maybe my fear is a bit irrational, but I discovered that you can get infections if the toilet is not clean and you're sitting on the seat. So I am legitimately very, very, very crazy when it comes to using public toilets. So I've tried everything. I've got a pee stick, which is impossible to use because, come on, we're not really trained to point much and my aim is bad. And tried squatting, which is great unless you're wearing a sari or a skirt, and then it's not very easy. Tried pee disinfectants, which was the best one, but you do run out of them. And then if you're not keeping track, there have been times when I've gone to the washroom and I don't have it. Um, I've also discovered that you can get infections from unprotected sex, and that also really frightened me. And I now insist that, well, now I'm married, but when I wasn't, I did insist on reports to ensure that, even with protected sex, there's no chance I'm getting anything. I am quite crazy when it comes to people visiting my home. Of course, you're allowed to use my washroom, but I will disinfect like 10 times afterwards. I don't want you to become like me, crazy obsessed about your toilet habits and hygiene, but I would very much. I think it's very important for us to be aware of how to prevent UTIs and how do you know in case you have one? What are the symptoms? Should you be going to a doctor? And how worried should you be if you do get a UTI? Because in the absence of talking about it enough, I do think there's a lot of misinformation. And so I'm hoping today's episode will guide us through the world of UTIs and how to stay safe. So we have with us today Dr. Deepak Ragoori, who is a senior consultant urologist as well as the facility director for the Asian Institute of Nephrology and Urology in Hyderabad. Hello, sir. How are you?
Hello, I'm fine. Good, thank you. How are you doing?
Very well, actually, because I haven't had to use public restrooms in a while, so I'm always very happy then. But it is the festival season. It is the time we're all going out to weddings. It is the time when Sometimes you can't help but use public restrooms. So I really thought this was a relevant topic. Before we get to the infection bit, I just wanted you to help for someone who may not know, understand the basics. So what is a urinary tract in females?
Okay. Perfect. Even before I start answering your questions, I appreciate the way you have started off your introduction to, today's topic on UTI and its health. It was a nice way of getting the audience to know as to how one thing leads to another. A lot of things happen at subconscious level in our day-to-day activities, and you don't really realize that these things have an impact on your life. And once you have to go through this unfortunate or a very unpleasant situation of urinary tract infections, then you start digging deep as to what did go wrong. What was it that actually troubled me?
Mhm.
So having said that, what is urinary tract? Urinary tract infection itself per se is a very loosely used term, if I may
Yeah.
say. A lot of people say that even if they have a burning in the urine, they say I have a UTI. The first thing a patient talks to me when he comes, he says, "Sir, I have an UTI." I said, "Madam or sir, it's for me to say whether you have an UTI or not. UTI is not a symptom, it's a diagnosis, by the way." And when you say urinary tract, so urinary tract per se, if you have to go back to a school science, we basically learn science in two different systems which come together here. One is an excretory system, like about our kidneys and our intestines, about both the urinary and as well as, the stool, which we pass on daily basis, is the excretory system and the reproductive system. When you put these two things together, it's called a genitourinary system, which is an apt word for us in medical school. And it involves in men or in women for urinary tract would be from kidneys. Kidney and the urinary bladder are connected by a thin tube called ureters. The urine is produced in the kidney and it is transported through these fine tubes called ureters into the urinary bladder, which is then pushed out through the urethra, or it's a passage for the urine to come out. In women, it's a very short tube, hardly 4 centimeters. And in men, there is another system that comes into picture where there is a prostate gland, and then the rest of the urinary passage, which is much longer when you compare to the women. So the urinary tract per se involves kidneys, ureters, urinary bladder, and the urethra, which is the outlet.
Right. And when you get an infection, it could be in any part of this tract.
Absolutely. That's the key. Urinary, like I said, urinary tract infection is a very broad term, and it could be
Yeah.
from any of these things. The origin could be any of these, and the infection part can be isolatedly infected any of these or together as a cumulative entity as well. Yes.
Yeah. So I'd like to understand a bit about the incidences of UTIs in this country. Is it high? And also, I am a woman, so I do tend to think of UTIs more from a woman's perspective. But is there a burden of male UTIs in India as well?
Yes, we do. Is one of the most common urological conditions, if I may say, urinary
Mhm.
tract infections. And the incidence, if I may say, varies from region to region, from men to women. Women are more susceptible to urinary tract infections than men, 4 times higher, if I may say. For every man who gets an UTI, there are 4 women who would be suffering from the same. And again, the incidence actually varies with the age distribution as well. In women, especially, if you have to look at and the age of puberty, women who are sexually active, and the
Mhm.
ones who are going through pregnancy. This is the age group, say, for example, from 18 to 20s to 40 to 45s, where 40 to 50% of the incidence sits in this age group. And the other extremes of young girls and the postmenopausal women who again have a different causes, but they also fall into this category of, who are susceptible to UTIs.
And when we say an infection, because it could be viral, fungal, bacterial, so with UTIs, is it all three or is it specific?
Primarily, we're looking at bacterial infections, which is interlaced or overlapped by fungal as well. Viral is something which is very, very, less we see in urinary tract. But the most common is bacterial. And yes, fungal infections can add on to this to make situations a bit worse. Yeah.
And what would be the most common bacterial UTIs that we have?
So the bacteria that we normally see is called Escherichia coli or E. coli.
Mhm,
Is
mhm,
75 to 80% of the time that's the bacteria we isolate in urinary tract infections. And there are other organisms that are relatively lessly isolated, like staph, proteus.
mhm.
These are relatively less pneumococcal infections. These are relatively less. Yeah.
Right. And it's really funny because with E. coli, I had kept a pair of turtles in. I remember reading this online that if I touch the turtle and then I eat it, I can get E. coli. And I always thought that was a stomach infection or a digestive tract infection. So essentially, it can do the same damage to your urinary tract as well.
See, the pathology as far as the gut is concerned, when you touch something and there is an
Mhm,
ingestion in form of through a oral source, that's
mhm,
primarily your intestinal gut infection, like you rightly said. But
mhm.
urinary tract infections, the source has to be directly from, it has to be through the urinary tract per se,
Mhm.
and no other
Right,
mean. The contact per se should be through the urinary tract. Yeah.
right. And now, supposing, God forbid, I've gotten contaminated and infected, at what point do I realize it's time to go to the doctor?
Yeah. So now the first thing is for you to differentiate the degree of symptoms. What are those common symptoms you see in urinary tract infections? The most often, at least from where we interact with the patients, when they say the first and the most significant one is burning in the urine. When you pass urine, it turns to hurt or burns. It's a very subtle difference. If you get confused whether it is burning or it is pain. Either way, it hurts when you pass urine. Two, there might be an increased frequency. You tend to go to the loo very often. You go back and then come back and again feel that you have to go back. But this profound feeling of wanting to go to the toilet is so much that every time you go, you don't see much of urine coming out. It's just the frequency. Your bladder is very irritable there. The ability for your bladder to hold urine for longer period of time comes down because it is irritable now. So hence the increased frequency. You might see blood in urine at times. That is another. So in that case, your infection status is a bit advanced. Yeah, blood in urine.
Right,
And
right,
and I would say the pinnacle would be having fever and a low back pain. The sign of
right.
fever and back pain means your infection is basically ascending close to the kidney from the bladder.
Mm,
If it's predominantly the bladder that is infected, the simple signs of burning and pain while passing urine and increased frequency. These are the two things. If it
mm,
persists for a longer period of time, when I say longer period of time, say for example, 4 to 5 days, and it doesn't subside, I think it's good to go see your doctor. But
mm,
having said that, you actually made a point, very interesting point when you started off, saying that the amount of water you take, has come down for whatever the XYZ reason. The present day lifestyle has changed so much that we really give a very blind eye to the water we take in. We really don't know. I mean, I keep giving all the gyan to my patients coming in, but am I drinking 3 liters of water per day, 2.5 to 3 liters? No, at times I think I am also falling short of it. Why? Predominantly, you're working in air conditioning environments, and you have a meal, you have a couple of glasses of water. What happens between in your office hours? Arey yaar, kuch to khana hai, you want to eat something, or you feel like
mm,
munching on something. You have a tea, maybe a couple of biscuits, or something to munch, maybe a healthy snack. You don't realize that you're actually thirsty. So, what is the difference between thirst and hunger?
right,
What is thirst? Most of
yeah,
the times, you see, you're either panting for water, you have a dry mouth, that's it. So, you mean to say that you don't have these issues at all between your breakfast and lunch? It's very difficult to notice. So remember, there's a small tip I would like to give. 60% of the times, your hunger is your thirst. So in between your breakfast and lunch, if you feel like you want to eat something, have 2 glasses of water. If your hunger persists, please eat. Nobody's stopping you. But 60 to 70% of the times, your hunger vanishes. That means to say
mm,
you were actually thirsty. So try and tune yourself so that you know what actually thirst is. Give your body enough water. And I think 70 to 80% of the times, this will take care of your UTIs. Water
yeah.
is the most important trick and the magic.
Yeah, I had a doctor who told me, food is all around you. And we are in such busy, hectic lifestyles that we're not really mindful of how our body is feeling. So you feel thirst, but you see food all around you. So you just automatically opt for food. And he said, make your water make your water look sexy. So dress it up and put it all around you. Put, apples and mint, and then it becomes alluring. So your mind tends to want that, and it does work. Except when I'm going out, then I'm consciously drinking less.
Water
Um,
in its only form, water. A lot of people ask, see, as doctor, I have chas, I have lime water, I have
yeah,
barley water. I said, doesn't matter. Water is water in its own form.
water is
No
yeah.
other form of liquids is, a replacement or a substitution for water.
Yeah,
Absolutely.
and then just regular water, someone said, I want to have the cleanest water possible. I said, well, that's battery fluid. Please don't have that. It shouldn't be completely clean. So a little
Yeah.
bit of dirt is good, I think. Coming to going to a doctor, you said that sometimes patients come in and say, I have a UTI, which I'm glad I'm not in Hyderabad because that would have been me. Um, I did once, you do those preventive health checkups, and my results in my urine culture showed white pus cells. And I just panicked. I'm like, UTI, I just know it. So I went and I did all the advanced tests also beforehand. And then I went to the doctor saying, no, I don't think I have it, but something's wrong. Um, but coming to the culture tests, they're very easily available. I know that much, but have they advanced? And should every diagnosis be done on the basis of a culture test?
Yeah. So, very good point. So, there are two parameters to how we examine urine. One is a urine routine examination, where you tend to pick up these pus cells or RBCs or epithelial cells, which we normally notice. And only if there is a clinical suspicion and if the bacterial load is significantly high, we go and ask for urine culture. I wouldn't recommend, to go, all out to do a urine culture very often. This is where you land up worried about your reports rather than yourself. And this is where you tend to treat the reports rather than the patient per se. Okay. Unless you're clinically suspicious about something, we don't normally push through the urine culture. Unless the urine culture is definitely positive, we don't label the patient as a urinary tract infection, that the patient has urinary tract infections. So as much as your urine culture is the definitive test to prove whether you have an infection or not, we also should be a bit guarded when you have to do this. It just puts you through an unnecessary, a trouble. I mean, I would say, yeah.
Yeah, stress. Um, I know that antibiotics is typically what you use to treat a
Mhm.
bacterial infection. Is that the same in UTIs? And because you keep reading about E. coli resistance setting in, is that a problem that's coming up?
Yes, and I mean, the very idea behind doing a urine culture is to try and isolate the organism that is the primarily causing this issue. And two, to also have a sensitivity or a resistant profile, the drug profile, which are the group of antibiotics which would help you and which are the ones which are not going to help. This is called sensitivity and as well as the resistant drugs. So if again, I coming back to the same thing, there is an entity called as asymptomatic bacteriuria. You tend to see the bacteria, you tend to see some element of positivity even in the urine culture. But if the growth is not significant and the patient is not having any symptoms at all, you don't tend to treat them. There are specific conditions where we would treat even an asymptomatic patient. I mean, I wouldn't want to discuss, that's beyond the scope of what we're discussing today. However, if you're symptomatic, your urine culture is positive, then the urine culture gives you an indication of which are the drugs which will help you. And I would take this opportunity to tell that off late, as clinicians, I would agree with all, I mean, most of the clinicians would agree with me that these days you see the urine cultures being most of the drugs, 80% of the drugs are coming out to be resistant. And there are very hardly few drugs which are actually helping. And those are very higher
Even for UTIs? Even for
even for UTIs, exactly. And this is the scenario which we used to see a few years back or maybe a decade ago, where unless you have used these antibiotics again and again, you wouldn't fall into this category of drug resistant. But these days, irrespective of whether you're using antibiotics recently or not, you're tending to see these. And it's quite a baffling scenario for us. We're trying to digging everything and everything we're blaming on COVID. I know that's a very easy way of talking. However, it's a very concerning situation for all the clinicians, just not us as
Yeah.
urologists. All these cultures are coming out to be quite resistant, multi-drug resistant scenario. And more so a reason, please do not take antibiotics at your whims and fancies. Please do not do that. Unfortunately, we are in a country where there are people happy to ask a pharmacist for antibiotics. There are more than happy pharmacists who want to give the antibiotics what the patient asks for, and the patients are happy taking them. I'm just, and this is
Yeah.
just very concerning. When there is somebody ready to buy and there is somebody ready to sell, there's nothing much we can do about it.
Maybe we should have prescription audits,
Obviously, the rule is very much in place. There are drug regulatory bodies in our country which have put very firm rules that you're not supposed to dispense medications unless there is a prescription. But you know how it works. The awareness from the patient's perspective. Let's not talk too much about the regulatory authorities here because that is not our job to do. However, I would, what do you say, go out and say to people out there, please do not, buy antibiotics and then just take it at your whims. The other way is, see, for example, a couple of years back, you have come to me with a urinary tract infection, and you have my prescription, which is 2022 dated. You stick it on your refrigerator and you take the pills every time you get UTI. No, it doesn't work like that.
Yeah.
So
Or you
when
use someone else's prescription.
yes, and the patients are jolly well saying that, sir, you would give me the same prescription anyway if I come to you again. I hope medicine was so simple, isn't it?
I keep saying that, it sounds so amazingly simple, doesn't it? Like if it worked for person X, it'll work for me as well. So why should I, stand in line, go to a hospital and, do extra
That's,
work?
yeah, that's one part. And you also believe that it'll work for you again and again,
I agree. So tell me, you've obviously been around as a urologist for a very long time, and you have a wealth of experiences when it comes to how a UTI can affect a person's life, um, not just their health, but just the quality of life. Is there something you could share on how bad can it get?
Absolutely. I would say more than a clinical concerns, UTIs can become a huge social concern. You're absolutely right in saying that. So now there are many youngsters, or elderly women or men, when they have these symptoms of UTI, which are actually subtle, but they're definitely hampering their day-to-day activity, they tend to cover it up with their lifestyle changes, or maybe like a few medications like we just discussed that, that are available to them, and they prolong that episode of meeting a doctor. So hence, in meanwhile, they don't realize that it is impacting their day-to-day life, be it increased frequency, the urge incontinence. When I say urge incontinence, the bladder is so irritable that if you get a sensation to void, to go to the loo, you have to go to the toilet. A 5 or 10 minute delay will result in urinary leak, to a certain extent that your undergarments are stained, or it's so discomforting when you're outside. In spite of going through this, they still hold back, and they take their own sweet time to meet a doctor. The frequency, urge incontinence stops you from being socially active. You don't want to go anywhere. I have seen patients who don't travel. They said, I can't travel. If I have to sit in a bus for 2 to 3 hours, it's not possible. I have to go to the loo every 30 minutes. And more so women, they have to, they're very, I understand, if I have to commit, most of the urologists are men. It's a male dominated, subspecialty. We are seeing a lot of women coming into urology. It's a very heartening thing. There are a lot of women who are still very hesitant to go to a male urologist to express their concerns. And that is another factor that delays. Most of them are associated with their gynecologists. Of course, they do treat, but there is a line where you have to draw, you have to move beyond a gynecologist to the urologist. And that's where a lot of women also hold back. They have issues with incontinence. They have issues with their social lives. They don't go anywhere. They don't travel. The sleep is disturbed because of the frequency. They're all groggy in the morning because they wake up 5 to 6 times in the night. So there is a huge social concern that is to be addressed because of the UTIs, not per se the urinary tract infections, antibiotics, and you coming to the hospital. You have rightly pointed out the social concern is so huge that I wish people, get in touch with their doctors. Let me make it very short. You didn't necessarily be a urologist. Go meet your family physician. It's okay. Meet your family physician first, whoever it is. They'll do the ABC of whatever is required, and then they'll patch you up with a urologist if need be. But don't hold back. Yeah.
And I think, you know, aside from the shaming bit of, that most women, or there are women who wouldn't feel comfortable talking about, their vaginas and so on, to a doctor, there's also, these are things we don't want to think about. We did a episode a couple of weeks ago on a poop transplant. And it was the same thing, right? It's like anything that's waste matter coming out of your body, you don't really want to discuss.
Yeah.
Not realizing that since it's traveling through your body, it does have very important markers for what's going on
Yes.
inside.
Yes.
So I do think, having these sort of conversations and normalizing saying the word, pee and poop. It's okay. Just another word.
Absolutely.
So I wanted to get to a bit which I really like doing. I like to scan the World Wide Web for as many assumptions about certain diseases and conditions, and I'd like to ask you to know whether they're true or not, because some of them sound very bizarre to me. So for UTIs, the first one I think is somewhat true, is that you are recommended to have cranberries or cranberry juice. But then I've also seen, people posting that they have a cranberry breakfast bar or cranberry muffins, or you have sweetened cranberry juice in a cocktail, which I'm assuming is not the same. So do cranberries help, and what form should we be having them?
Yeah. Okay. Cranberry and D-mannose, these are the two things which are supposed to help you, especially when you have recurrent urinary tract infections, by having its role on the flora which is there in the urinary system or in the bladder. Now, let me be very clear on the guidelines perspective, because your social media, your information out there is very much available that cranberry has its impact. I wouldn't say absolutely no, but I wouldn't say it's absolutely yes either. The level of evidence on medical terms, let me see. If I have to put it at A, B, C, D, that's how it is. A being very strong, C and D being very weak. The evidence in urological guidelines, on medical guidelines for cranberry being used to prevent recurrent urinary tract infections is weak. That means the evidence is there, but not as strong as we can put a blanket statement saying that all of you take cranberry juice and you might not get a UTI again. Let's not push it to that, but there is no harm in taking it. Like you rightly said, in this process, you're dumping in a lot of sugars in your muffins, your this, your that, your bar, whatever
Yeah.
it is. Your cranberry packed juice is loaded with sugars. Have you ever realized that? And that actually has an impact on your urinary tract again.
Even the
Yes.
dried cranberries, it's
Yes.
impossible to get them which aren't sweetened.
Absolutely. And mind you, diabetes is the one of the concerning metabolic diseases or lifestyle
Mhm.
diseases, which is most common cause for UTIs. When we have not discussed that, but in a country which is called the diabetes capital of the world, that is the most common cause for your UTIs, diabetes. So mind you, whatever you take, just don't jump into things and take this, artificially sweetened cranberry stuff. As much as we don't know whether it will help you or not, your sugars will definitely harm you. Yeah.
Yeah, actually, there are some imported brands which are unsweetened, pure cranberry juice, but that is so expensive. It doesn't seem worth the
Yes.
gamble. Um, there are also certain people who believe, and I wouldn't go into the religious part of it, but they say you can clean your vagina after you use a public toilet. With antiseptic or sanitizers, or there are a variety of herbal creams, and some of them have cow products with cow urine, which purifies. None of them have any sort of scientific research done,
Yep.
except for antiseptics, which I guess it is. But should
Absolutely.
you be doing any of this?
Absolutely. Your question or a statement has the answer in it. There is no scientific basis for that. However, the simple concept is to keep your genitals clean after you pass urine or after you use a public toilet, like you said, where the seat might not be clean. Just because you have used a public toilet, you're not susceptible for UTI. Let me make this clear. Not everybody who goes to a public toilet comes out with an UTI. However, The contact is very important, especially in women. If you're using a public toilet or a seat, where you sit and the contact happens, that is when the chance of you getting a UTI goes up. Having said that, again, the idea is to keep the genitals clean. You can use a regular simple body soap, just water or your wipes, more than enough. There's nothing else that is required to be used. And I wouldn't, as far as my knowledge goes, I don't see any scientific basis for this. And you need not do anything beyond a simple water and body soap for the
Yeah.
genitals to be kept clean. Yeah.
And supposing you hold your urine for a very long time, and urine is perceived to be, having germs in it, do the germs then infect you, and do you then get a UTI because you've kept them in for too long?
By default, the urine is supposed to be sterile. Even if there are bacteria, it's called sterile bacteria. They are not supposed to be harmful. But if you hold your urine for a long period of time as a habit, in long duration, there are certain entities where this can result in urinary tract infections, more so to the kidneys. There is a certain condition, especially in children, where the urine goes back from the bladder into the kidneys back again. By definition, the urine is supposed to be flowing in only in unidirection, produced in the kidney, comes through the tube, into the bladder, and out. It's not supposed to go back. But there are certain conditions where you tend to hold back. And if you have a problem with these tubes, the bladder urine again tends to move back into the kidney. And that is a concern in kids, especially if they're of a habituation of that sort. We normally ask them not to do that. And also unnecessary, you are distending your bladder to unnecessary proportions, which might cause some urinary tract issues rather than infections per se. But yes, yeah.
Yeah. And what role do probiotics play in prevention or even in treatment of UTIs?
Like Cranberry, if you have to go scientific basis, probiotics can be two ways, both oral and local. There are a few solutions where you can use, like you said, for the vaginal, probiotics, oral probiotics. Both are considered to, help in growing of a very positive flora, in the bacteria that is friendly, gut friendly, also genital tract friendly, which might help you to avoid getting urinary tract infections again and again. However, the scientific literature and the evidence is still weak on that. Like I said, no harm in using, however, we still are skeptical about its actual
And,
benefits.
and cervical cancer, now I know it's caused by a virus,
Yes.
um, but it it has nothing to do with the UTI, does it? Or is there any sort of link between the two?
Nothing. The confusion here is most of the times, the ones who have a HPV, human papilloma virus, or the initial stage of cervical cancer, they have symptoms which are very similar to UTIs, So the baseline confusion is the urinary tract infection related symptoms to a cervical cancer patient having some urinary symptoms. The basic confusion is there, not otherwise. It's not that the urinary tract infections lead to cervical cancer, not at all.
Yeah.
It's a HPV, the human papilloma virus, that leads to this. The baseline confusion is in the symptomatology and the similarity in which the patient presents, not otherwise.
Yeah, I think it's also as most women, we don't really understand our own bodies, particularly the vagina. And I know a lot of people don't know that there are two holes
Exactly.
and they're very separate.
Yes.
So
You're right. You're absolutely right. There are many women who comes on when they see blood in urine, they really don't know whether it's actually coming from the bladder or is
yeah,
it that they have blood in the vagina that
yeah,
is into colored
yeah,
stained urine. So
yeah.
you should be in a position to understand yourself, your body much better.
Mm.
If not for anything else, for the peace of mind for yourself. You should know yourself better.
Yes, it should. In fact, the way we take care of our skin, which is
Yeah.
heavily talked about, and you'll find even a 9-year-old talking about collagen and peptides. And what are you talking about your vagina as well?
Okay.
Also a part of you.
Yeah. And yes,
Um,
one of the most common causes, let me complete that loop in women.
yes.
The most common causes for urinary tract infections is vaginal discharge. White discharge per vagina is one of the most common conditions where it can lead to, because the secretions from the vagina enter into the bladder very easily. There is normal white discharge. You should be able to differentiate what is normal white discharge and what is an abnormal one for you to go consult your gynecologist. So that's again one of the basic things that you should be able to know about yourself. There is a regular white discharge that happens during your periods, versus what is abnormal and which persists again and again, which has to be treated. Else, this leads to your recurrent urinary tract infections. One of the most common reasons we see in this part of the world, in country. And yes, sexually active women, this again, you mentioned about unprotected sex and this. Even otherwise, sexual intercourse per se is one of the risk factors for UTIs in women, especially in young women. The newly married couples, the newly married women have this spike in urinary tract infections, which leads to bladder infections. We call it as cystitis. And there is a very, nice term for it. I might say, if I might say it's nice, it's called honeymoon cystitis. So hence, the initial phase of your post marriage, that where you have sexual intercourse, and then that is the time where it triggers this urinary tract infections. It is termed as honeymoon cystitis. These young couples do have this concerns. Yeah.
That's something to remember, Yanni. Just the last bit, we have touched upon the causes of UTIs, but I'd just like to wind it up by talking about prevention. So this is that time of year, like I said, we're all going to be going out and using restaurants or banquet halls for weddings, or we're traveling. India doesn't have the best of public toilets, but sometimes you don't have a choice; you have to use. As a urologist, what advice could you give for preventing?
Yeah. So I would say water, and more water. So your magic mantra should be adequate amount of water. 2.5 to 3 liters is what is recommended for a normal healthy male or a female. And don't be bothered about the frequency component. Just you feel that you might have to go to the loo when you're traveling. Don't cut short on your water. The best we can do is time the way we empty your bladder before your travel. If you can find a sensibly decent restroom in on your way, or once you reach your destination, you could be selective about it. Worst come scenarios, there's no harm in using, but don't hold back your urine, for a longer period of time. And at the earliest, if there's any sign of discomfort or you feel the symptoms are troubling you, do meet a physician or a urologist if he is available at the earliest. And the personal hygiene part, which we have already discussed, be aware of yourself, be aware of the signs that your body gives you. Everything, any issue, your body definitely gives you signs of warning. Respect your body and meet your physician as early as possible. The first sign of anything, don't try to self-treat yourself. That is another thing which I would say. Don't push it too long. Don't push your luck as much as you want to. So water, self-care in terms of personal hygiene, and meeting your physician at the earliest when there are signs, warning signs, should do it.
I'm so fortunate to be able to do this podcast because my philosophies for things are always corrected. So I had it completely wrong for UTIs. I wasn't drinking water. So thank you so much for giving us the right perspective on UTI. Thank you, sir.
Thank you, Sonali. Thank you so much, and it's been a pleasure talking to you. And it was, it was very interesting the way you put your questions, and I'm happy that I could answer most of the queries that would help the people who are watching this
The question
podcast.
comes from the heart as a fellow concerned health person. One of the frequent arguments that I have with my male friends is their inability to understand that peeing is a nightmare for women when we go out. And it's not just because of UTIs. A lot of times particularly during weddings, when they have a makeshift toilet, they're in dark spaces, and it's not the safest thing by yourself, particularly at parties or weddings where there's alcohol involved. So I do insist very strongly that I have the right to urinate, and I must be accompanied by somebody. And if it's not a man, I ask for a woman, and we give each other company. But it is important to realize that urinating is very essential, and to not be able to do it because of poor public infrastructure or bad information or just apathy, because you don't have to go through the same thing. It is a pity. So I do think we should be talking more about every part of our body and every biological function, and insisting on the right to safety and good health. But I hope this episode helped you. And if you've learned something from it, I'd love to hear about what your thoughts are. Next week, we also have an episode releasing on workplace stress management. And if there's something you'd like to be answered, then you can write to us about that as well. We're available at pods@indiatoday.com. You can also text us on 8588 And again, if you enjoyed this episode and it's giving you some relief when it comes to urinating, then leave us a good rating. We are there on Apple, YouTube Music, Spotify, the India Today website, and a whole bunch of other audio streaming platforms.